The vast majority of people that we are supporting in our practices through the functional medicine lens who are wrestling with chronic disease dynamics, they are not wrestling with toxicity because of a single or a few episodic acute toxic exposure. Especially those of you who work in acute or emergency medicine, you know what that looks like. This is often treated at the hospital. It is an acute dynamic that must be dealt with. I'm speaking about the much more prevalent, I would actually say omnipresent dynamic where individuals are struggling with persistent oxidative stress and damage that promotes inflammation as a result of chronic toxin overload. And this has to do not necessarily with any acute exposure, but rather a persistent exposure that overloads their unique body's ability to biotransform and excrete those particular toxins. The language here is also something I want to talk about right away because we talk a lot about detox. It's quite the catchphrase, but I think something that's important as practitioners to realize is that it is certainly a well-hyped, well-marketed, often exaggerated and overstated concept with all sorts of different promises that are not necessarily anchored in science at all. And I have a real concern with this because it has called out into the light a question of, what is this about toxicity and detox? Is that even a real thing? Is there any credibility to the notion that people need help with detoxification? Yes, there is. But a lot of this sort of marketing hype language around detox programs and helping people with detox, unfortunately, is damaging the credibility of a very real functional imbalance that many of our patients and clients are wrestling with.